What does the Gorman Center do for clients to check and treat for TMD? That's part of our comprehensive exam with patients. Sometimes we have patients come to see us with that issue. They're coming because they have jaw issues and they want to know what's going on. Otherwise, they're here for comprehensive exams or for workups before doing major therapy or even minor dental therapy. We want to check those things. And how we do it is we look at how the jaw opens and closes. We actually palpate the joints to see if we feel anything or if we hear any noises there. We look at x-rays to see what the condyles, the top part of the jawbone looks like, and also the eminence of the skull that it articulates in, to see if we can see any issues there. If patients are having symptoms, we want to determine, is it actual internal derangement of the joint itself, or is it muscle symptoms, the muscles of mastication that move the jaw around? Is it putting pressure on the joint? Is it just headache related? Is it bite related? So we spend a lot of time analyzing bites, both kind of what we call straight up and down bites or maximum intercuspation in relation to where the jaw joint wants ideally to close. And if there are discrepancies there, then we call those bite interferences. And those bite interferences can trigger activities like clenching and grinding and those things, trying to self-correct that can cause the muscle symptoms that lead to further problems within the joint. So when we find those things, especially if they're muscle issues, we want to find exactly where the ideal jaw position is. And a lot of times we have to get the muscles relaxed before we can do that. And one of the things that we do often is what we call splint therapy. And superior repositioning splints, the idea of that is to create an artificial bite with an appliance that kind of fools the body into thinking it has a perfect bite. So the muscles can start to relax and the jaw joint can start to fall into its proper position. So we adjust the appliance as things are changing till we get to the point where the patient's symptoms are subsiding, and we get a repeatable opening and closing position. We have an even bite on the appliance. When the lower jaw starts to move in different functional positions, the correct teeth are hitting on the appliance as if it's a perfect bite in the mouth. And then we find things become more coordinated, things are more comfortable. We can find where the jaw joint really wants to close, and then therefore set up the bite correctly when we're doing the dentistry.